Welcome to miniEM. In this video, I'm going to walk you through the corner stitch. This is also called a half-buried horizontal mattress. This is your go-to technique for V-shaped or triangular skin flaps. So this is our skin flap here. For this is just a linear laceration, so you're just going to place simple interrupted sutures along the length of this. And same thing along here. But this skin flap has really bad blood supply, and it's fragile, so you don't want to place a suture needle through this skin flap. What you're going to do instead is you're going to pass horizontally through the dermis of this flap tip, and all of your knots are going to stay on the non-flap side. Okay, so you're using non-absorbable sutures for this. You're going to start over on one of the non-flap sides. You're going to enter, come out in the dermis, and I usually reset here so that I can get a good bite on the flap. Now, evert the flap tip, and you're going to pass horizontally through the dermis of that flap tip with your needle. You're staying at the same depth the whole way through, and you're not coming out the skin on that flap. Reset, and then you're going to place just a normal suture from the inside of the wound. You're going to come out on the non-flap edge. So now as you pull on your sutures, you'll see that flap tip kind of seat itself into a good position. You can just do a normal instrument tie here. And again, you can check out one of our other videos to learn how to do an instrument tie. Look at how nicely that brought our flap tip into this dead space right here, and you're not destroying any of this delicate tissue in the meantime. All of your knots stay on the non-flap tip side, and you can cut your tails to about 0.5 centimeter. Again, close the rest of your wound with simple interrupteds. So you'll go here, 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 here. All right, that's how you place a corner stitch. Check out the rest of our miniEM library for some more procedural education.